Okay. All right. Sorry about that. I realize now that maybe my recording didn't start, but we're going to get started here now. Once again, the slide deck will be available on our website. So if you're watching this recording, all of the material in the slide deck was just reviewed, and we're just about to start our draft rule text review. All right, in the chat, I just dropped a number of links, one of which is going to be to the WCARES rulemaking website. This is where you're going to be able to find the links for the material we're going to review today, the CR 102 that has been filed for our general provisions, beneficiary eligibility determinations, and requirements to provide approved services. You're also going to find links to the DSHS website, the Employment Security Department rulemaking website, and the Healthcare Authority rulemaking website. You'll also have the email for general questions for WCARES, but also my contact information to submit any sort of written comment or reach out about any questions about rulemaking. One thing I want us to know today is that the material we're going to be reviewing is in addition to the material that has already been filed through CR 102. So the CR 102 material includes a lot of definitions that we are using in the rule text today. I do encourage folks that if you do have questions about terms, to refer back to that material, especially as it relates to long-term services and supports providers, approved services definitions, beneficiary definitions, or eligibility. So you'll find that they're listed under CR 102. You'll also find links to the material that I'm about to review. So if you're someone who likes to follow along, please feel free to click those links and pull it up on your side. I'm going to be presenting this on the screen as well. So feel free to follow along in whichever way works best for you. So you should be seeing now the PDF of the rule text here. What I'm going to be doing is I'm going to review this whole document first, and then I will open it up for any questions. So please give me a moment to review this, make sure we cover all the material, and then you're going to be able to ask any questions, provide any comments, feedback. You're welcome to do that by raising your hand, and I will work my magic on my side to allow you to come off of mute. You're also welcome to use the chat, and the chat should be open to everybody at this time. All right, let's get started. We start off this section, we're looking at the payment and reimbursements for approved services section. We start off here with a new WAC that's going to be associated with our provider requirements, or the requirements to provide approved services. This is an exception to a provider-related rule section here. We say that a long-term services and supports provider may request an exception to a provider-related rule. To request an exception to a provider-related rule, a long-term services and supports provider must submit a written request, including justification, to the department. Decisions about exception requests are not appealable, and we'll talk more in a few minutes here about what is appealable. Next, we're talking about payment for approved services. We list here that to receive payment for approved services, a long-term services and supports provider must enroll in a department-authorized payment system and adhere to billing standards and guides established by the department. A long-term service and supports provider may claim up to the maximum rate for an approved service unless they are excluded from subsection 3, which is the consumer-directed employer. The rate charged for an approved service is determined and agreed upon by the eligible beneficiary and the long-term services and supports provider. And the long-term services and supports provider must not charge an eligible beneficiary more than the maximum rate unless approved to do so under our exception to a provider-related rule. So as I just mentioned, the consumer-directed employer is an exception here and must claim at a set rate as established in contract. And we've added a definition of claim here, which means to formally request payment from the department for approved services provided to an eligible beneficiary. Next, we talk about maximum rates. And the department will pay long-term service and supports provider for approved services rendered up to the following maximum rates. I'm not going to go through each line item here with you, but what we do is we list out the approved service, and the definitions of these approved services can be found in that CR 102 link that I put in the chat. And we list the maximum rate and the unit in which that maximum rate is associated with. So you'll see an amount in each, or you'll see per hour, you'll see daily, per month. And so we specify what that maximum rate is and what the unit for that rate is. So we go through here, we list all of these out, and then we define a maximum rate, means the highest amount the department will pay for an approved service. And unit means the smallest amount in which an approved service is authorized, provided, and billed. Next, we speak to eligible beneficiary reimbursement. An eligible beneficiary may pay privately and request reimbursement up to the maximum rate for adaptive equipment and technology and transportation. In order to request reimbursement, an eligible beneficiary must submit a reimbursement request and a receipt for the purchased item to a financial management services vendor. That receipt must include the name of the seller, the date of the transaction, name of the approved service, method of payment, and total amount paid for the approved service, which includes additional required fees or costs such as tax, shipping, or transaction fees. A request for reimbursement must be submitted to the financial management services vendor no more than 60 days after the date of the transaction. And for the purposes of this section, we've defined a financial management services vendor as an entity contracted with the department to administer reimbursements to eligible beneficiaries, acquire adaptive equipment and technology on behalf of an eligible beneficiary, and process claims for provider payment. And reimbursement means payment to an eligible beneficiary from their benefit by the financial management services vendor for costs incurred in the purchase of the approved service. All right, so with that, that's the end of this section of rule that we are proposing. I'm going to pause here to see if there's any questions, comments, feedback. And once again, you're welcome to raise your hand and I will provide permissions for you to come off of mute. You can also use the chat feature. If you'd prefer to type out a comment or question, you're welcome to do so. So I'll pause here for a minute to let folks digest the material we've reviewed. And if you have any questions, comments, or feedback, please let me know. All right, I'm not seeing any hands raised. And I'm not seeing anything in the chat just yet. So for now, I'm going to continue on. Please feel free to continue if you're typing. Please put it in the chat. We can circle back around. We have plenty of time today, but we will continue on with our notices and administrative hearings section.
Oh, Ariel, there is one question that just popped into the chat.
Okay. All right. And I am actually going to look, Katie, and for those of you here, Katie is helping us behind the scenes here. Katie, do you happen to know the answer here to this question?
Well, I can certainly say that our rates are going to be increased with inflation. They're going to have methodology to be increased over time so that they are as much as possible, consistent with what we're seeing in other rates. So I do think that it is going to continue to be updated and kind of viewed in alignment with Medicaid, but obviously it is a different program and it may not look exactly the same. But it is going to be continuously, and all of our rates are going to continuously be monitored to address any sort of concerns regarding inflation or any sort of increases and changes that may exist.
Wonderful. Thanks so much for helping out, Katie. I appreciate that. And one of the things that we will be doing as part of any rate adjustment is because these rates are going to be in rule, we will be doing new rulemaking activity to adjust those rates. So there will be notice that will occur. We'll go back through the rulemaking process to update those rates in rule when we need to adjust them. All right, thank you, Katie, and thank you, Justin. Let's continue on here as we move to notices of department actions and administrative hearings. So the department will provide written notice when a determination is made by the department. We'll cover here shortly what a determination is. Written notice will include the date of the notice, the effective date of the determination that has been made by the department, the reasons for the determination, the specific regulations on which the determination is based, contact information for a department representative, administrative hearing rights if applicable, and other information required by state or federal law. Except as described in subsection 4 of this section, the department will send notice of a determination that terminates benefits or discontinues provider registration at least 10 calendar days before the effective date of the determination. The 10-day notice period starts on the day after the date of the notice. The department may send a notice to a long-term services and supports provider fewer than 10 days before the effective date if the provider requests the determination, the provider violates registration requirements or operational standards, or the provider dies. The department will electronically notify long-term service and supports providers and provider applicants of department determinations, and the department will electronically notify applicants and eligible beneficiaries of department determinations. If the determination denies a beneficiary application or terminates beneficiary benefits, the department will also send a copy of the notice via U.S. mail. For eligible beneficiary administrative hearing rights, a person applying to be an eligible beneficiary may request an administrative hearing to dispute a department determination. And an eligible beneficiary may request an administrative hearing to dispute a denial of reimbursement or termination of their benefits as well. A provider administrative hearing, or for provider administrative hearing rights, a provider applicant applying to be registered as a long-term services and supports provider may request an administrative hearing to dispute a department determination. And a long-term service and supports provider may request administrative hearing to dispute a discontinuation of their registration. For administration, my tongue is sticky here. For administrative hearing requests, a request for an administrative hearing must be received by the department no later than 5 p.m. on the 30th day from the date the notice was sent. Days are counted as described under WAC 388-02-0035, which is going to be the DSHS hearing rules. An administrative hearing request may be made by submitting an electronic request to the department, calling WACARES directly, mailing a request to the department, notifying a program employee in person at any of the department's regional office locations or at an area agency on aging office, or submitting an online request to the Office of Administrative Hearings, or contacting the Office of Administrative Hearings in writing, in person, or by telephone at a location specified within those DSHS hearing rules. To ask for assistance in requesting an administrative hearing, contact one of the department's regional offices, an area agency on aging, or the department at our WACARES telephone number. To be complete, an administrative hearing must contain enough information to identify the person filing the request, the department determination being disputed, and the contact information of the requester. If a party disagrees with an initial order and wants it changed, the party must request review by a review judge as provided in the DSHS hearing rules. If a party requests review of the initial order by a review judge, the initial order will not be affected. Appeals will be resolved through the adjudicative proceedings governed by this chapter, and by the Administrative Procedure Act, Chapter 50 B04 RCW, which is our WACARE statute, the DSHS hearing rules, and the model rules of procedure. And then we have a clarification here about how to handle conflict between this chapter and other chapters. We have a hierarchy here to be clear. So that's the end of our content for today. I'm going to open it up once again for any comments or feedback. I see there's been a little activity in the chat while I've been talking. So I will pause here for just a second to get caught up. But again, you can raise your hand if you want to come off of mute and ask a question or provide comment. Also, the chat is available. So I will give us a moment here and get caught up in the chat. All right. We have a question about, will beneficiaries be notified if the long-term services and supports provider contract is terminated? And I will pause here to see if our provider network team here in the background can speak to that.
Yeah.
Yep. Okay, go for it, Katie.
Yeah, so this is something that's actually presently being addressed internally. There is not a system level situation where they would receive a notification in their user account, as it were. But we are exploring other ways in which to ensure that providers are aware if a registered provider that they were working with is no longer available. Provider contracts do have an obligation if a provider knows they're going to be closing their doors, etc., to provide notification to both the department as well as any impacted beneficiaries that they're working with. But in the event that someone's contract or registration is terminated or someone is deregistered from the program, we are actively working on the means or the way in which we would like to ensure beneficiaries are made aware. But I don't have a specific procedure to list at this time, but it is something that is actively being discussed and we can find a solution.
Wonderful. Thanks so much, Katie. I appreciate you jumping in. Lynn, I see your hand up. You can come off mute now.
One item as I kind of read through this on administrative hearings where I think beneficiaries might have questions or contractors is who is handling the administrative hearings. Because I can understand if it's a beneficiary and they came through the AAA door and we denied eligibility, that we would handle that hearing, but it might not be clear to beneficiaries. And the one I really wasn't clear on is for the administrative hearing to dispute a denial of reimbursement or termination of benefits, where exactly that one will lie, because I know that question will come up later. And I'm sure for provider administrative hearing, it will probably be, is it a contract that's being managed by the AAA? Is my assumption that's the answer for that one. Thank
Wonderful.
you.
Thanks, Lynn. Appreciate that. And that is a great call out. Thank you. All right, what else? Any other comments? And we can open this up for the material that we previously reviewed regarding rates and beneficiary reimbursements. So if you have been thinking about the material and digesting, that's okay. We can talk about any of the material we've talked about so far. All right, and then I think your hand came back up, so you should be able to come off mute.
All right, I'm just pondering over things as we go through these.
Perfect.
So kind of going back to the benefits and maximum rates, I noticed there was a question for Muriel, will there be any other services along with assistive technology and transportation that a beneficiary can be reimbursed for? And that made me wonder about what kind of guidance is going to be there for beneficiaries around what is adaptive equipment and technology, because I could see a lot of confusion purchasing medical equipment, thinking it is adaptive or assistive technology. So that just got me thinking, ooh, what kind of guidance is going to be there for beneficiaries who may not think about going to the WAC to look at what's actually listed as eligible to purchase.
Yeah, that's a great call out. I'll take that back to the team here. And I know there's been lots of discussion around that adaptive equipment and technology, and see, see what we can think through on that part. But great call out, Lynn.
I will say that there will be, we are intending to make sure that there are resources available to beneficiaries about adaptive equipment and technology in WalkCares, because there will be a couple different ways in which they could get support or assistance or acquire what they need. But also, we are hoping that our financial management services vendor will also be able to offer assistance and support to beneficiaries who have questions as well about those purchases as they would be handling the reimbursement process. So I do know that I just wanted to mention that there are some things that are actively being worked on, and we definitely plan on kind of addressing that with beneficiaries to make sure that they're informed.
Wonderful. Thank you so much, Katie. All right. Any other comments, questions, feedback regarding our payment and reimbursement for approved services and our notices section, as well as our administrative hearing section? All right, Muriel, you can come off mute now.
Yeah, so I was just wondering for the transportation, I know it says for 260 miles per month. And I realize there is above, like, it sounds like there's an exception process if someone needs more. Our area is super rural and it can, like, having to go to a major hospital could use up someone's miles, like there are that whole 260 in one trip. So is there going to be a process for that for people who are ongoing needing more than that 260-mile limit, not just like a one time, just because the land, like, to get from Wenatchee to Moses Lake or to Ritzville or Spokane is such a far distance, that it seems, at least for our area, we may run into beneficiaries needing more miles fairly consistently.
Wonderful. Thanks for bringing that up. And I know that this is coming from our Long-Term Services and Supports Trust Commission subcommittee regarding rates. So I'll pause here to see if anybody on the provider network team is familiar with that discussion. If not, we're going to take it back and do some research into that as well. So I'll pause here for a second, but also may need to follow up further.
Yeah, I think we definitely want to follow up a little bit further. I think that that's, thinking about sort of recurring needs as rather than like singular exceptions. I think it definitely is kind of its own kind of conversation. So I definitely would like to take that back and discuss it further at the department. But I appreciate the question.
Wonderful. Thanks, Katie. And thank you, Muriel, for bringing that forward, and certainly making sure rural communities are represented here in these rates. Really appreciate that. All right. Anything else here before I start wrapping up? I'm not seeing a lot of activity, but I also want to remind folks that we are accepting written comments through the end of the day today. So if you step away from this, you're digesting, and you want to submit some comments, you are more than welcome to. We really encourage it. We do want to hear your perspective and feedback, so we can present our best possible draft for our CR 102 that we're working towards. All right, Lynn, you can come off mute.
Right. Sorry, it's just as you keep looking at these, more
Mhm.
things keep coming up. I was wondering about home delivered meal rates because I see $16 each, but I know we're doing a lot of work to increase access and develop more for medically tailored meals. And
Mhm.
those are at least what we're looking at with some new funding has a much higher rate than that. Is there any consideration on whether it's a regular home delivered meal versus a medically tailored meal?
I believe the way this is written would be that would be the maximum for anything billed as a home delivered meal. I would be curious though, if you know more about what rates are being used, if you wouldn't mind sharing that content, that information with us, and you can send that over via
Sure.
email, just so we
Sure.
have some numbers to look at and understand what
Okay.
may not be being represented within this rate.
Okay, I will send that over.
Thank you. I appreciate that. Thank you. And yes, I will say that there is a part of me pausing here just to let everybody digest and think through the material. So thanks for hanging in there with me, but also really appreciate these comments. All right, Muriel, you can come off mute.
Yeah, so I just have kind of two questions looking through this more. One, is there going to be like some sort of provision or way that a beneficiary doesn't necessarily have to pay the maximum rate to a provider? If, for instance, that rate is above what's usually common, just looking at like the PERS, it's very, most of our like our PERS providers aren't charging $85 monthly. So is there kind of going to be a almost like a protection in there for some of those services where maybe if they were just paying privately out of pocket, they wouldn't have to pay as high of a rate to keep their fund from running out faster? So that's kind of my first question.
Okay. I believe Katie is probably going to be able to answer that one really well. So I'm going to pause here and turn it over to Katie.
Yeah, absolutely. So one of the things that we're reinforcing in our contracts with our providers is that the expectation is that they are charging WalkCare's beneficiaries the same rate that they would charge someone in the public sphere that had, in the same geographic location, had the same needs for the same services, etc. We're referring to it in our contract as being a usual, customary, and reasonable rate. Obviously, they need to be under the maximum rate. But we are asking providers to provide us a copy of their rate sheet for informational purposes only when they register with the program, simply so that we have an understanding of what their standard rates are. We know that, in the program, it is going to be the responsibility of the beneficiaries to kind of have these conversations with their providers about the rates and understand, what is involved in those rates, etc. But we are in our contracts expecting and letting our contractors know that they are expected to charge those reasonable, customary, and usual rates. The maximum rate should not be the standard rate arbitrarily, especially. And if at the department, through monitoring practices, we find that there are, circumstances that could be overcharging or other things like that, those can be addressed, directly with a provider, and have further conversations about the certain rates that they may be using. But essentially, when a provider and the beneficiary discuss the rate, the provider is going to be responsible for putting the pre-authorization into the Provider One system, and the beneficiary still has to approve that rate. So they still have an opportunity to say, I don't like that rate, I don't want to approve this rate. And we also have contract language that does not allow them to charge private pay over the maximum rate, or require people to essentially pay additional funds out of pocket to secure their place or secure a bed, things like that. So we have written protections into our contracts for our beneficiaries, but we are expecting our providers definitely to use those usual, customary, and reasonable rates. I hope that answers the question.
Well, thanks so much, Katie. I also want to call out the language here that we're proposing in 381164010 that says long-term service and supports provider may claim up to the maximum rate, but the rate charged for an approved service is determined and agreed upon by the eligible beneficiary and that long-term services and supports provider. So hopefully that also will kind of speak to Lynn's question, is that these rates really do need to be agreed upon between both the beneficiary and the provider. The pre-authorizations can be created for up to 3 months, and rates cannot change during that time without closing a pre-authorization and creating another, which would mean at that point the beneficiary would be able to agree with the new rate before any other services are rendered or increased rate. So there should be quite a bit of transparency in rates, and also giving that opportunity to the beneficiary to say, this provider, the cost is more than I really want to pay. I'm going to look for a different provider that's able to provide the services at the right budget for me. So I'll stop there. And Muriel, you mentioned you had a second question, so I'll turn it back to you.
Yeah, so my second question is on just the notice of department actions. And I'm just kind of wondering, I know it mentions like um, terminating beneficiary benefits. Is there like a specific kind of example or situation that this is kind of in preparation for? Like if a beneficiary's already been approved and it's not that their fund is running out, why they would possibly be terminated?
Yeah, I can speak to that. So we had some language in our other packet that, again, we filed a CR 102 for, that says if a beneficiary has been inactive for 12 months, that their account, not their account, but their benefits will be closed and they'll need to reapply. So that would be an example of when we would be terminating someone's benefit before they've exhausted it. And that's a way just to not leave these accounts, or not the accounts, but leave the benefits, open, ongoing for eligibility purposes. But also, we recognize here that that would be an appealable event. So that's what this is going to be speaking to. All right. I'll give us just one more pause and then work to transition. While we're pausing here, I'm going to drop some of these links that I posted at the beginning back into the chat, just to push them back up for folks. We're going to have our rulemaking website. This is where you're really going to find all the material that we are doing. This is where we post our CR 101s, our 102s, our informal document review or draft reviews. You'll find recordings there. You're also able to sign up for our DSHS rulemaking delivery. And so if you haven't been getting notifications from us, or the emails that say, hey, we have this activity going on, please make sure to sign up. But also, if you know folks who are interested in WCARES who maybe are not attending these meetings or not getting notifications, please remind them to go sign up. This is really how we message out any activity that we're doing for rulemaking. And I really don't want folks being left out of that if they're interested. You'll also find our CR 102 with a hearing coming up August 5th. That's going to be for material that we covered back in April. We also did some listening sessions back in 2024. So a lot of work has gone into that packet. We have our draft documents here that we reviewed today, which is that payment and reimbursement for approved services and notices and administrative hearings. We are accepting written comments here through end of day today. So if you do have some ideas after we're done here, or you take this back to your team and you talk about it and say, hey, we have some additional comments or questions, please know we're eager to hear that by end of day today. And then I have some just general websites here for the DSHS rulemaking website, Employment Security Department website, and Healthcare Authority website. All three of those departments are part of WCARES. They and will all be doing rulemaking activity. So please follow along with them as well if you're interested about WCARES rules as a whole, not just DSHS rules. Otherwise, my email there is at the bottom. It's ARIELLE.F as in Frank, INNEY 2 at dshs.wa.gov. And that's where you're going to be able to submit written comments to me regarding our material we reviewed today. All right. I'm going to transition us back to the slide deck. We're going to just start wrapping up here a little bit. So these are the resources I just put in the chat. Feel free to use them. Feel free to get familiar with them, follow along for rulemaking activities. But last, I just want to say thank you. Thank you to each of you for spending your time here today with me, chatting about our draft rules. We spend a lot of time thinking through a lot of things, but you provide these fresh set of eyes, fresh perspective. That's really, really important for us to be able to step back from us being in the weeds of it and just kind of get a sense of like, how is this interpreted by others, particularly those who are invested and curious about our program and making sure WalkHeres is the best possible program for our beneficiaries and providers. So we couldn't be doing this without you. I just always want to say that, you know, loud and proud here at the end is that your contributions really do help us get to a good final product. And I know I really appreciate it. And I know my team behind me really appreciates it. All right, all. Thank you all for being here. And I hope you have a wonderful rest of your day. Again, submit those written comments to me if you have any additional thoughts. Take care all.